Hi, my name is Dan Griffin. I am a reproductive endocrinologist that works at Boston IVF at the Women's Hospital. A fertility specialist is someone who has done training, typically in obstetrics and gynecology. After medical school, they spend 4 years doing that training, and they do additional training for another 3 years in fellowship. Ideally, if a patient can come to see a fertility specialist before they start chemotherapy, that is the best option. However, once they have completed their treatment and have had clearance from their oncologist to proceed forward with pregnancy, we would encourage somebody to seek out treatment sooner, within the first 6 months to get their options. So we work closely with patients' oncologists in regards to setting up fertility preservation treatment. The process usually takes 2 weeks to do, and we would ensure with the oncologist that that was going to be safe for that patient before we would start the cycle. So the process of doing an egg retrieval for egg preservation, it takes about 2 weeks, and it involves 2 steps. The first step is a patient would take fertility medications that would stimulate the ovaries to produce eggs, and that is usually over the course of about 10 days, give or take a day or two. And while a patient would be on these medicines, they are monitored periodically for their ovarian response with either a blood test and an ultrasound to look at the ovaries. And then once they had a good number of those follicles on their ovaries, then 36 hours or so after that, they would have the retrieval, and then the process is done. In terms of protecting eggs or ovarian reserve once chemotherapy has started or prior to starting chemotherapy, there are 2 different medications that can be used for that process. There have been studies looking at oral contraceptive pills, as long as it is, again, okay with their oncologist to be on those medicines while they're undergoing chemo. And then there is a medication which is called Lupron, which patients can take during their chemotherapy that has been shown to lower the effects of the chemotherapy on egg supply. That is always an option for patients who would go into menopause, or should they have a lower egg supply after their chemotherapy and we're having difficulties getting pregnant. In terms of the financial aspects of fertility care, there are several different financing options that we offer here for patients to get financing or loans for treatment. But we also work with the Livestrong Foundation, which provides all of the medications that a patient would need for treatment at no cost, and also would provide the service. We would provide the service at a significant discount for patients. You do not need a referral to come and talk to somebody like me. A lot of times we'll get referrals from oncologists, but it is not necessary. And for situations like this, we try to get patients in as quickly as possible. One question I get asked a lot when patients come to my office who are undergoing cancer treatment is how the effects of chemotherapy will affect their fertility. And the main reason for that is because women, unlike men, they're born with all the eggs that they'll ever have. And as women get older, the egg supply will just naturally decrease until it's some level that they go into menopause. And some things can accelerate the process of somebody losing their eggs, and chemotherapy is one of those things. And so if a patient has undergone chemotherapy, then it can lower their egg supply, which either can put them into early menopause or potentially, affect their fertility in the future. And so one of the treatments that can be offered in this situation is to freeze eggs prior to undergoing chemotherapy, to act almost as an insurance policy in case somebody were to go into menopause or have effects on their fertility after treatment.